Hello. So today we are talking about FENO. FENO also called as fractional exhalation of nitric oxide. So nitric oxide is a gas which is produced in our lungs and our airways, which can be detected when we exhale it. So normally the levels are maintained less than 30 parts per billion. But in patients and in children who have asthma or an asthma which is called as eosinophilic type of asthma, the levels of nitric oxide can be very high. This is done with the help of a device which is called as a FENO test. Now this is a handheld device in which it is attached to the monitor. In this handheld device, the patient is asked to breathe out and a filter which is attached to it for a period of at least 6 to 10 seconds. Now there are certain cartoons and some pictures which will help the child to maintain a steady breath for 6 to 10 seconds. After that, we take the best of 3 readings and the level which is highest is chosen as the level of FENO. Though asthma is a clinical diagnosis, this test helps and aids not only in the diagnosis of asthma but also in the long-term management and the treatment trajectory of the patient. Now, if your patient has been responsive to steroids, the levels of FENO will gradually drop. You will also know that the inhalers that the patient has been started if the patient is compliant and is adjunct to the treatment. It is more helpful in patients who have severe asthma to know if the FENO levels have been dropping after you have started the patient on steroids. Now, many times these FENO levels can be done in your OPD basis as easily because it is non-invasive and it is very simple to do in children who are more than 5 years of age. There are certain prerequisites which need to be followed before we do the FENO test. In this test, you be sure that you do not perform the spirometry before you do the FENO test. So, as a rule, always try and do the test before you do the spirometry. We also try to avoid a diet which is rich in nitric oxide. Ideally, we would like to have a room which is free of nitric oxide, but may not always be possible. This test was very simple and it is also included as one of the diagnostic features in the British Thoracic Society and the newer NICE guidelines, where levels of more than 35 parts per billion can be taken as a diagnostic modality if your spirometries are normal. Thank you.